We are super excited. We're going to dive into another peptide for you all today. I know that many of you have been loving the series on peptides. They're so fun to dive into and learn about. And I'm sure we're going to have a lot more information now that Becca has gone to the Peptide Congress conference too. But speaking of live events and conferences, I
Yes.
want to remind you that we are hosting our first FitMom Summit. It is called Own It. It is going to be live in Chicago area, Illinois, Arlington Heights, about 20 minutes from O'Hare Airport, September 5th and 6th. And we have an amazing lineup of speakers: Rachel Shear, Vince Pitstick, got Dr. Fitz. She is a local doctor in our area we're really excited about. Roxanne Safi, Megan Del Corral. She's the clinical director and co-founder of Vital Medical, the team that we partner with. And so I'm so stoked. I'm so pumped to get everybody together in the room.
Yeah, I think our lineup is pretty phenomenal for a first event.
Yes.
I am very proud of us, and I'm super excited for the relationships we've developed over time with these people, and that they're so graceful to, come and do it for us and make this event amazing. It's going to be so many avenues of things that are talked about and perspectives and the knowledge. And the big thing for me with events and why I love going to events is I just have this renewed sense of drive and excitement, and it's for the self-development piece. They just make me so much more amped to do things.
Yeah.
And so if you feel like you're in a rut or you're stuck or you just aren't sure where to go, I think sometimes being around people and learning different methodologies and belief systems and all of that, just having the open-mindedness of it alone can be life-changing.
Yeah. And we've been really intentional with putting these speakers, in our lineup, that they align with our values, but also that they are going to pour into you. Like, they genuinely want to pour into you and help you if you do feel like you're alone on an island walking this journey. I think the really cool piece about what Vince will be presenting on is why women struggle so much. And women do struggle to comprehend some of the things that he talks about, because you get bits and pieces maybe from, social media or different podcasts, but the way he's going to lay it out to help you understand you're not crazy is going to be wild. But we are bringing in Rachel and Roxy to kick us off, talking a little bit about the relationship with self and how you get on your own team. Like, if you're not on your own team, how can other people be on your team, right? Like, you've got to have a good relationship with yourself because you are with yourself all the time. You don't escape yourself, right? And so a lot of the mindset, the mental, emotional work is what we're going to open up with, which will be great to set kind of the stage for growth and opportunity and thinking differently and allowing and creating space for this growth and elevation in your life. And then connections. I mean, connecting with like-minded people, connecting with women in the FitMom community, connecting with others who are walking a similar journey as you. Maybe you are really, challenged right now and you feel like, God, I'm at a loss and nothing is going to work for me. But you meet somebody who's there to encourage you and say, hey, I felt that way a year ago, and now I'm in a completely different spot. And so we want you in that room with us. There is a link in the show notes to sign up and register. We have lunch that's being catered. We have some amazing partnerships and sponsorships that we're going to be giving away some functional testing. If you're doing the VIP with us, you're going to dinner with us. We're going to glam you up on Friday night. And then we also have transportation to and from the hotel with a room block at a discounted rate. So we tried to make it very affordable because we recognize people are going to be flying and traveling from other places. So link is all in the show notes for you. We hope to see you there. If you want to bring a friend with you, message myself or Becca and we'll give you an extra $100 off to bring your sister, your friend, your mom, whatever. But we are keeping this a women's only event, and tickets are limited to 75 because we want it to be intimate. We want to be able to spend time with each of you, connect with each of you, and build those relationships in person, and then give you a hug too, because I like giving hugs.
Yes. No, yeah. We want to meet you. So let us know if you have any questions on it. But yeah, let's dive into SS31, which is one of my new favorite peptides. It has been, especially for the people that feel like they're constantly inflamed. They've been doing the fasting, they've been doing the dieting, they've been doing the things, and the body's not responding very well, or for the really sensitive clients. And let's talk about why. So SS31 is what we call a mitochondria-targeted peptide. Okay, so it's been shown to be potentially effective in protecting and healing mitochondrial damage. Most notably, it can potentially prevent issues like something called perioperative neurocognitive disorder, which is described behavioral or cognitive changes that can potentially occur after surgery or anesthesia. So that's like more in older adults. But one of the big reasons that I love it is it basically scavenges reactive oxygen
Mhm.
species. So reactive oxygen species can create a lot of damage to mitochondria. And one of the problems is that eh, when you are going through life and you age and you have toxin exposure, it basically reduces your ability to produce energy and repair tissue when you have these ROS levels in really high amounts. And this is why, again, I love genetics testing for people that really struggle with mitochondrial function in genetics. This can be really, really helpful because those people tend to honestly be more predisposed to like disease, chronic disease,
Mhm.
cancers, Parkinson's, things of that nature, because their mitochondria just does not, it ages faster, basically. And the older and more metabolically damaged you are, the harder it is to stimulate new mitochondrial growth. And then you also end up with essentially regeneration issues. So like cells don't regenerate as well. And the immune system becomes really, really, assaulting against the mitochondrial function. And so when reactive oxygen species are not scavenged and they are not prevented from, inhibiting the body, they basically have the ability to damage the essential parts in the cell. And so SS31 works. And the issue with dysfunctional mitochondria is that it can cause more oxidative stress. So like this is a vicious cycle that people end up with, is that you essentially have all of this inflammation, have all of these reactive oxygen species. Maybe you don't have enough antioxidant production from the body, you aren't taking in enough antioxidants, or you just have too much stress and assault on the system. That then turns into the mitochondria aren't healthy. They become more shielded. They basically have these things that kind of like act as guards at at the beginning of the mitochondria and like protect itself. So they become enclosed. They basically don't produce energy, but then things can't get into the cells. Things can't get in. Things can't get out. And that becomes a really big problem. And this is where we call like the cell danger response, is what a lot of people refer to it as. But yeah, this is SS31 helps to start clear. Think about like, okay, I'm starting to peel back this damage that's done and start to slowly kind of bring back function to the mitochondria.
Well, and a big part too is when the body is not functioning well, there's can be mistakes that are being made with the DNA copying as we age. And so this can result in not only inflammation, and rusting, as we call oxidative stress, like the internal rusting of the body, but you age a lot faster. So you fatigue out, your skin looks, not glowing and wrinkly and all these types of things. But the really big piece that I kind of geek out on with some of this stuff is that when we look at LPS or lipopolysaccharides in the body, this comes from gram negative bacteria and they can create a lot of inflammation. They are part of different bacteria that are more like stealth infections. Let's think like C. diff, if you ever had that, or food poisoning, right? So these things leak out into the bloodstream and that creates a lot of issues. But one study looked at LPS induced inflammation and oxidative stress, leading to difficulties with learning and memory, because a lot of this can cross the blood brain barrier, impact the liver, lead to non alcoholic fatty liver, a variety of things there. But lipopolysaccharides, this part of the cell wall that can activate the body's immune response to infections, is also responsible for cell death and inflammatory response. And so SS31 peptide is very powerful in counteracting the LPS activity. So it can calm down on that inflammation, again, clean up the oxidative stress. And again, when we look at the trickle down effects of what this can do for individuals, it can give us a lot of benefit. So we'll go kind of high level here. Improves memory. So I already mentioned that, right? So there was a study done with mice that were taught how to find their food in a maze. Some mice were exposed to lipopolysaccharides. These are endotoxins. The body says, whoa, this is toxic. I got to get it out. Very inflammatory again, and even inflammatory to the liver. So once the mice, basically, they looked at the mice that were exposed to lipopolysaccharides, and they ended up taking a long time to find their food. The other mice that received the SS31 peptides, they could go back to the same speed they'd found their food before being exposed to LPS. So it helps with improving memory, improving mitochondrial function, as we just talked about. So increasing the energy. The mitochondrial membrane potential is used to indicate any mitochondrial activity. We have the ATP, which refers to the energy that the mitochondria create and the fuel that the cells need to function. But MMP allows not only cells to communicate with each other, also allows it to pass energy back and forth, pass this ATP back and forth. So when there's low MMP, there can be wrong signals sent to the cells and a decrease in ATP function. So a decrease in energy. And therefore, the SS31 can help the body maintain proper mitochondrial membrane potential levels as well as ATP. So that helps protect the cell integrity as well. Again, reducing oxidative stress. We want to clean things up. We want to turn things over. We want to get things out. SS31 inhibits reactive oxidative species. So that will suppress the inflammatory response in the body. And then it prevents cell death or cell apoptosis. So cells that produce too much reactive oxygen species will inhibit electron transport. This potentially leads to depolarizing membranes and causing cell death. But SS31 can remove those reactive oxidative species, and that prevents the activation of cell death pathways. So by doing this, you can protect your mitochondria from making these mistakes and this dysfunction.
So in real life application, like what can you experience with it, right? So one of the big things is it can enhance physical endurance. And this is where I like it, when someone's really acutely struggling, like we mentioned, maybe they're fasting and not seeing the results they want. They're, doing all the stressors and like their body's not adapting properly, basically. I will sometimes bolus dose SS31. So that's where you'd bring it in a higher dose, shorter period of time. In more of a maintenance situation, this is where you put it in on rest days. And the reason you put it in on rest days is because, okay, if SS31 is acting on the reactive oxidative species, we're acting on the inflammation. I typically wouldn't put it in on a day. And in terms of like more maintenance dosing, you wouldn't put it in on a day that someone's going to the gym and creating all of that, right? You put it on a day, like a rest day, where that can then do its work when the body is in more of a rested state, right? And so this can enhance physical endurance. One of the big things that it has shown support with in terms of research is the ability to perform, because one of the main drivers of sustaining physical exertion and physical activity is the mitochondria, right? So our survival is kind of dependent on the production of energy from the mitochondria. Once you stop producing ATP, well, you're dying. It's why mitochondria is such a focus for peptides. Like the peptide world is all focused around the mitochondria. But one thing to understand, and we've talked about this before, and why I like SS31 so much is because it does not stimulate mitochondria. It helps support the damage to mitochondria. Most peptides do both. And sometimes you don't want to stimulate the mitochondria more. Sometimes you're overstimulating it. And that in itself can create ROS and inflammation. And so the SS31 just heals, which is why in people that are overstimulated, that the body is in this chronic stress state, I like it so much for, because they don't need more stimulating. Like the people that do all the things, the cold therapy, the fasting, the, exercise, all the things, those people sometimes aren't going to do well with stimulation. It actually makes things worse for those people, because again, you're creating too much ROS when you stimulate the mitochondria too much. It needs to be a balance, which is why peptides can be it's an art, right? It's an art and a science. And so that's why, yes, experimentation on yourself can be fun, but you got to be careful, because you can create a worse situation. So people with a disruption in the functioning of the mitochondria can suffer from that lack of energy, that I do workouts and I feel worse. I can't recover from my workouts. And so then you can't push in workouts to create muscle development and dense muscle tissue to kind of be there, so you get that look that you want from working out so much, right? And so this is where the effect of physical endurance has come from. So when I took my higher dose SS31 for a few weeks, I was doing some fasting during that. It was kind of like a dual process we were going through. I felt better in the gym than I had in a really long time. I felt like I could push more. I felt like I was recovering even with fasting in the mix, even with lower carb in the mix. And now I use it just on my rest days to help basically the recovery aspect of training hard, right? So it also can prevent cardiovascular disease. So, physical activity and cognitive improvement, but it basically minimizes the risk of cardiovascular disease, particularly age-related cardiac conditions. So diastolic dysfunction is basically when the hardening happens in the heart's ventricles. So that is when those artery walls become really hardened, and it restricts the function of the heart. So there was an 8-week study using this in old mice, and they saw a substantial reverse of that hardening. So it normalized the mitochondrial mechanism, which is called the proton leak. This is what happens when you stimulate mitochondria too much, and it reduces mitochondrial reactive oxygen species in those cardiac muscle cells. So it basically concluded that complications due to age-related cardiac conditions could be reversed.
Yeah.
with improving the mitochondria.
It's pretty crazy. I mean, when you look at this, I know that, people like Hunter Williams and Jay Campbell, they kind of call this the healer because it can even help for people who have had like traumatic brain injury. They have had, cancer in the past. They've had some organ damage or, things like that, kidney disease, muscular diseases, thinking about, again, diabetes, high blood sugar, and things like that. So I think that it's a pretty powerful one and it's pretty safe. Obviously, this is not medical advice. We're not telling you guys how to dose yourself. There's a lot of things like Becca was saying. You can do more like bolusing, so higher milligrams for a shorter amount of time. Or, again, I have it in on my rest days as well, usually 2 to 3 days a week, and then other things that I'm doing on my workout days. So this is something where we would always advise you to be working with somebody or at least educate yourself, maybe buy some of the peptide protocol books, look into that, what you're using it for before you just start dosing yourself up. But I think it's also important to look at the side effects, right? So there are minimal side effects of this, but we always want to cover it because each person is very different and it depends upon what all you have going on. Sometimes when you're putting in peptides and you're starting the healing process, that can initiate a Herx reaction for
Mhm.
some people. So they're like, oh, wow. Like I've had some clients with EBV, for example, where they get a flare. And sometimes when we're in a healing, whether this is with homeopathy, things like symptom relief kits from Des Bio, or you're using peptides or whatever, they might experience more joint pain, fatigue, or headaches. And then the next time they're going through like another maybe symptom relief kit or another round of SS31 or another peptide, they have a little bit of a flare, but it's less than before. So that tells us like we're getting into the virus or whatever it is that we're targeting to help heal. But a couple of the common things are headache, dizziness, as I mentioned, itching, and mild redness at the site of injection. Of course, depending upon what you're mixing it with, your practitioner or doctor, whoever you are working with for dosing, would be one to help work through this and manage those Herx reactions and guide. The dosage for SS31 can be upwards of 40 milligrams per day, but some people do it even higher than that in terms of, again, bolusing. And so this is something where you should work with somebody to give you that set instructions for dosing and the time frame. And then, for me, I'm always thinking about what can be part of my long-term longevity routine that's also not breaking the bank. That's where having this in, 2 to 3 days a week. Some people do it on the weekends. Some
Mhm.
people will do it 2 to 3 days on their rest days, whatever, you might be using it for. And then you can back off and use other things that support the mitochondria. One of the things that I use a lot in practice, I know Becca does as well, is urolithin A, NAD+. Those can be great supports for the mitochondria, quercetin, various other things. But I think that the SS31,
Mhm.
especially when we're thinking about acute phases of healing where we need to come in and really help the immune system calm down, can do wonders for people, again, to get them out of that place as fast as possible. So these are generally administered through injections. Again, work with somebody. This is not medical advice. If you need help, you're wanting to understand how to use peptides, what that can look like in your protocols, we do work with those in our practice. We have a few practitioners that use them, as we're going through healing phases. So link is in the show notes. You can always book a call with our team and we can go from there.